It's cold today, but spring will be back. But when? And so will the pollen. An expert is here to help fight that. And speaking of weather, Hilda, this spring it could be a record breaker, at least in one category. We're talking about allergy season. The sneezing and wheezing has already begun. Here now is Dr. Sally Bailey, an allergist at MedStar Georgetown University Hospital. Thank you very much for being here with us. As I said, it's already begun. So we are experiencing watery eyes, itchy throat. I know I am. Sneezing, nasal congestion. But how do I know that that's not a cold, but an allergy?
Sure. Well, thank you for having me. It's a great question because it's something that a lot of people get confused. Typically, both will have itchy, watery red eyes, sneezing, runny nose, cough, congestion. But typically with a cold, after about 7 to 10 days, your symptoms should resolve. Sometimes with the cold, which is a viral infection, you may have a fever or body ache. That's not typical for an allergy.
All right.
So if you're feeling that, think cold, but if you're not and your symptoms persist, think allergies.
All right, so it's an allergy, but now what is giving us the fits right now? We have tree pollen, mold, what's the
tree pollen. Okay. So tree pollen is typically our spring pollen, and typically it starts in March and it goes on through May. This year with the cold that we've had, it started late. We're not even at our peak yet, so the worst is yet to come.
So this miserable winter is just making everything miserable for us.
It is, and if you remember back a couple of winters ago when we had a lot of snow, all that moisture fed the trees and we had a ton of pollen. That's about the same repeat pattern that we're having again. So that's why we're saying the worst is yet to come.
All right, so give us some tips to avoid feeling the worst of the symptoms. What should we do?
So one of the things that I recommend is keeping your windows closed. Even though it's nice and you want that fresh air to come in, keep the pollen out.
And turn the air conditioner on.
And turn the AC on, exactly. And when you come in for the day, go ahead and shower. Wash your hair, wash it off your body, and if you need to, rinse it out of your eyes and your sinuses as well. Change your clothes. That helps, as well as taking some over-the-counter allergy medications.
Do you recommend any specifics or just whatever works for you?
Well, you know, some allergy medications work better for some patients than others. If you've got more congestion, doing a saline rinse and following it up with a nasal spray may work better than taking an oral tablet. For some patients, it's their eyes, so an eye drop may work better. But if you're having sinus infections or wheezing, that's the time where it's getting more complicated and you should probably see a physician.
Because I was going to ask you that. When was the time to see the doctor instead of self-medicating, and the wheezing is something very different?
But you can definitely go to your drugstore and try those out, and if it's not working, then definitely take care of it, because like I said, the worst is yet to come.
Thank you, Dr. Bailey, for that diagnosis. Good to have you here with us.
Thank you.
And we'll be right back.